Welcome back to Thrani, I'm Joe B. In this video, I'll show you how to fix foot oversupination. Let's dive in. What are the signs and symptoms of oversupination? When you land on your foot during walking, running, or jumping, the ankle tends to roll inward with lateral border of foot pain. You will also notice clawing of the toes and an increase in wear and tear on the lateral border of the shoe. The causes of oversupination can be due to dominance of muscles that invert the foot, like the tibialis anterior. How does the foot oversupination occur? It results in the tibia stuck in external rotation. There's also calcaneal inversion, subtalar supination, and medial longitudinal arch elevation. As a result of the oversupination, to keep the medial border of the foot flat on the floor, the talonavicular joint and the calcaneocuboid joint has to pronate. Such talonavicular and calcaneocuboid compensations, or what we call midfoot compensations, will result to an associated forefoot compensations. And because of this, the talonavicular supination will result to the first ray plantar flexion, eversion, and abduction, while the calcaneocuboid supination will result to the fifth ray dorsiflexion, inversion, and adduction to allow the medial border of the foot to be flat on the floor. In addition to the first and fifth ray compensations from the talonavicular and calcaneocuboid compensations, then the second, third, and fourth ray now has to pronate to assist in keeping the medial border of the foot flat on the floor, since oversupination can result to elevation of the medial arch and the toes coming off the floor. In order to assess the presence of oversupination, we perform what you call the squat test. The patient will be standing, feet shoulder width apart, arms at sides, head in neutral, trunk in neutral. And from this particular position, the patient is asked to squat down as low and as comfortably as possible. If your patient has oversupination, the squat test will cause or show either a genovarum if the talonavicular and calcaneocuboid joints, as well as the first and fifth ray, as well as the 2, 3, and 4th rays, are able to compensate to prevent the medial border of the foot from rising too much off the floor. If the midfoot and forefoot joint compensations are unable to occur, then oversupination is worse and will result in rise of the medial border of the foot, as well as clawing of the toes. Once you have confirmed the presence of oversupination through squat test, it's time to treat. And the first order treatment is mobilization. The patient is in supine with foot close to the edge of the table. The therapist will be at the foot of the table facing the treated foot. The right hand is placed on the distal leg to stabilize, while the index finger of the left hand is placed on a dorsal cuneiform bone and the middle finger on the dorsal navicular bone. The navicular and cuneiform bones are then pronated with left torso rotation. This can be done for 30 seconds hold for 3 to 5 repetitions. This is another angle of the mobilization technique where you can visualize the index finger of the left hand on the dorsal cuneiform bone, while the middle finger on the dorsal navicular bone. In order to counter oversupination, you can also ask the patient to perform either a seated or standing foot flattening, which can be performed by cueing the patient to keep the big toes flat on the floor while trying to elevate the lateral 4 toes. This particular exercise can be held for 5 to 10 seconds and for 10 to 20 repetitions. Another exercise that can be performed is either a supine, side-lying, seated, or standing ankle eversion that can be done actively for 10 to 20 reps. to prevent muscle atrophy of the ankle everters that counter ankle inverters for oversupination, you can also perform supine or seated ankle eversion isometrics. This position or tension can be held for 5 to 10 seconds for 10 reps, and it can be progressed to TheraBand exercises for ankle everters, eventually to isokinetics and closed chain exercises. If you like this video, please like, share, and comment. And for more therapy animations, please subscribe to Therani.